Michelle, and this is my audience. I have 5 people, all adults. Okay. And my persuasive speech topic is midwives versus doctors. And I'm trying to persuade you guys to go toward midwifery just because it's better, and you'll see why. So this is kind of how the trends of the uses of midwifery while assisting births has changed in the United States. So you can see here in early 1900, it was close to 95%. Closer to 1939, it was 50, and then it went way down in the mid-90s to about 6%, but it has risen steadily, and it's now at about 9.4. So, in case you don't know what a midwife is, there's 2 different kinds. There's a certified nurse midwife and a certified professional midwife. A certified nurse midwife first gets her or his bachelor's in science with a focus of nursing, and then they have to go and get their master's in nursing with a focus of midwifery, so that's kind of like their specialty. And through that, you have to have a proctor and deliver like 75 babies and conduct a couple hundred prenatal visits. They can either do home births or hospital, but they also take care of adolescents through menopause and even later. They can provide infertility counseling and treatment and birth control, and just do normal exams or provide prescriptions, and even some assist in surgery. So that's pretty cool. And then certified professional midwives, they are kind of the entry-level midwives. They have a 2-year degree, and it's mostly independent study. And they also have to deliver 75 babies before they can even sit for the ANRM. So they're still, like, even though they don't go to college or a normal university, they're still trained and held to the same standards for delivery and taking care of women. They're just less medical. And then an OBGYN, who's also a physician, is a skilled person who is, or a person who is skilled in the art of healing. So they generally deal with the high-risk pregnancies and the high-risk women that are like obese or have HIV or cancer or just have history of preterm labor. So they're kind of more systematic, clinical, and they're there in a case of emergency. So the reason you should use midwives is because they are safer due to less intervention. The New York Times quoted this from the Britain's National Institute for Health and Care and Excellence. And they say that it has been concluded that it is safer for healthy women with uncomplicated pregnancies to give birth under the supervision of midwives than in hospital maternity wards run by doctors. And earlier, like I said, this is due to less intervention, like using forceps and anesthesia that can go wrong, or surgical procedures that can pose infection, like C-section or episiotomy. So that's one reason you should use midwives. Another is midwives have lower mortality rates than doctors. So Japan up here, and this is Japan, Europe, the UK, and the USA. The USA, they only use 9.4 of their births are assisted by midwives. And they have the highest mortality rates. And Japan up here uses 70% of their births are assisted by midwives, and they have the lowest mortality rates. In Europe and the UK, it's pretty common that both doctors and midwives assist pretty equally, but the high risk go to the doctors and the low risk go to the midwives, and that's just how it is there. The CDC actually said that the risk of experiencing an infant death was 19% lower for births attended by certified nurse midwives than for births attended by physicians. So if a government website is saying it, it's probably true, and 19% is pretty significant when you're looking at 1 in 5 babies. And then the Journal of Advanced Nursing said that midwife-led care was found to have a statistically significant positive effect on some physiological and emotional outcomes for women when compared with physician-led care. So midwives are very holistic care providers. They are usually the ones who take out an hour of their day to spend with one person, as for OBGYNs who are slammed with clients and have to take no more than 15 minutes sometimes. And so midwives are seen as people who can be there for emotional counseling, not just like the medical side. And women actually say that their prenatal experience impacts their birth experience, and if you don't have a connection with your provider, then your birth experience is probably not going to be very positive. And another reason you should use midwives is because the comparative costs in midwives versus OBs. So if you are using a professional midwife, that's usually using your home or a birth center. It's between $2,000 and $4,000 for the whole thing, prenatal plus the birth, and even postpartum. If you use a nurse midwife in the hospital, it's a little more spendy. The midwife you're going to be paying about $5,000 for, and then just birthing in the hospital is around $9,000 for the normal uncomplicated birth. And then if you use an OB, the OBGYN costs alone $12,000 for the whole thing. And the hospital cost will be another $9,000. And if you have to get a C-section, which are higher rates with OBs, you could be spending between $17,000 and $25,000 just for the C-section. So adding all of that, it becomes pretty costly. So if you use a midwife and you have uncomplicated birth and uncomplicated pregnancies, then it's the safer route going economic-wise. So what can you do to spread good news about midwives is just spread the word about the benefits of using a midwife. And if you haven't had your children already or are pregnant, consider them, because they're a good option, as research shows. So yeah, just spread the word, and that's what you can do to raise awareness of midwives and bring that 9.4% up.
Done?
Yep.